different things. We're going to talk about what are antibiotics, what is antibiotic resistance, why you should care about antibiotic resistance, why bacteria are becoming resistant to antibiotics, how antibiotic resistance happens, the importance of antibiotic stewardship, and how you can protect yourself from antibiotic resistance. So, what are antibiotics? Antibiotics are also known as antimicrobial drugs, are drugs that fight infections caused by bacteria. Antibiotics fight these infections by killing bacteria or making it difficult for bacteria to grow and multiply. Antibiotics do not have any effect on viruses, however. The term antibiotic originally referred to a natural organic compound that kills bacteria, such as certain types of mold or chemicals produced by living organisms. Technically, the term antimicrobial refers to the natural or synthetic man-made compounds. However, many people use the word antibiotic to refer to both. So, what is antibiotic resistance? Antibiotic resistance is the ability of bacteria to resist the effects of an antibiotic. Antibiotic resistance takes place when bacteria change in a way that lessens the effectiveness of drugs, chemicals, or other agents designed to treat or prevent infections. The bacteria survive and continue to multiply and spread, causing more harm. Antibiotic resistance is not just a problem for the person with the infection. Some resistant bacteria are likely to spread to others, encouraging antibiotic-resistant infections. Since it will be a number of years before new antibiotics are available to treat some resistant infections, we need to improve the use of antibiotics that are currently available. So, why should you care about antibiotic resistance? Antibiotic resistance is one of the world's most pressing public health problems. Antibiotic resistance can cause illnesses that were once easily treatable with antibiotics to become dangerous infections, prolonging suffering for both children and adults. Antibiotic-resistant bacteria can spread to family members, schoolmates, and coworkers and may threaten your community. Antibiotic-resistant bacteria are often more difficult to kill and more expensive to treat. In some cases, the antibiotic-resistant infections can lead to serious disability or even death. Although some people think a person becomes resistant to specific drugs, it is the bacteria, not the person, that becomes resistant to the drug. While antibiotics are life-saving drugs that treat bacterial infections, they are not without risks. Each year in the U.S., at least 2 million people become infected with bacteria that are resistant to antibiotics, and at least 23,000 people die as a direct result of these infections. Antibiotics cause 1 out of 5 emergency department visits for adverse drug events. Antibiotics are the most common cause of emergency department visits for adverse drug events in children under the age of 18. So this graph shows antibiotic expenditures in the U.S. by treatment setting totaling $10.7 billion back in 2009. Of that $10.7 billion, 62% of antibiotic use is in the community setting or primary care setting, 34% in the hospital setting, and 5% in the nursing home setting. It is clear that we need to improve the use of antibiotics across the spectrum. So how does antibiotic resistance happen? Bacteria can become resistant to antibiotics through several ways. Some bacteria can neutralize an antibiotic by changing it in a way that makes it harmless. Others have learned how to pump an antibiotic back outside of the bacteria before it can do any harm. Some bacteria can change their outer structures so the antibiotic has no way to attach to the bacteria it is designed to kill. After being exposed to antibiotics, sometimes one of the bacteria can survive because it found a way to resist the antibiotic. If even one bacterium becomes resistant to antibiotics, it then can multiply and replace all the bacteria that were killed off. This means that exposure to antibiotics provides selective pressure, making the survival bacteria likely to be more resistant. Bacteria can also become resistant through mutation of their genetic material. So why are they becoming resistant to antibiotics? Overuse and misuse of antibiotics can promote the development of antibiotic-resistant bacteria. Every time a person takes antibiotics, sensitive bacteria or bacteria that antibiotics can still attack are still killed. But resistant bacteria are left to grow, multiply, and spread. This is how repeated use of antibiotics can increase the number of drug-resistant bacteria. One example of overusing and misusing antibiotics is using antibiotics to treat viral infections. Antibiotics are not effective against viral infections like the common cold, the flu, most sore throats, bronchitis, sinus infections, and many ear infections. Widespread use of antibiotics for these illnesses is an example of how overuse of antibiotics can promote the spread of antibiotic resistance. Smart use of antibiotics is key to controlling the spread of resistance. So this table shows in more detail which conditions are caused by bacteria and viruses. It also shows whether or not antibiotics are necessary to treat the condition. So just a quick look at this. Some of the infections that you would use antibiotics for again would be strep throat, whooping cough, and urinary tract infections. You may use antibiotics for some sinus infections and some middle ear infections, but you would not use antibiotics for bronchitis or chest colds, common colds, runny noses, sore throats, or the flu. So we have room to improve antibiotic prescribing in the outpatient setting. Recently, the CDC estimated that 30%, almost one-third of the antibiotic prescriptions written in the outpatient setting were unnecessary, meaning that no antibiotic was needed at all. Even among the necessary 70%, there is still more inappropriate antibiotic prescribing, including inappropriate antibiotic selection, meaning the wrong antibiotic may have been chosen, inappropriate dosing, and inappropriate duration, meaning that the antibiotic was given for too long or too short of time. Total inappropriate antibiotic prescribing, including unnecessary antibiotic prescribing, inappropriate selection, dosing, and duration, is likely much higher, however. So what is antibiotic stewardship? Antibiotics are wonderful medicines, they're life-saving, but like all medicines, they do have risks and benefits. Antibiotic stewardship is the effort to measure antibiotic prescribing, improve antibiotic prescribing so that antibiotics are only prescribed and used when needed, minimize misdiagnoses or delayed diagnoses leading to underuse of antibiotics, and ensuring that the right drug dose and duration are selected when an antibiotic is needed. So just some tips on what you can do to protect yourself from antibiotic resistance. What to do. Tell your healthcare provider you're concerned about antibiotic resistance and ask them if there are any steps you can take to feel better and get symptomatic relief without using antibiotics. Sometimes the best treatment for your illness may be relieving your symptoms, not an antibiotic. Take the prescribed antibiotic exactly as your healthcare professional tells you. Always discard any leftover medication, and ask your healthcare professional about vaccines recommended for you and your family to prevent infections that may require an antibiotic. Vaccines are also an important way to keep diseases from spreading. So what not to do. Never skip doses or stop taking an antibiotic early unless your healthcare professional tells you to do so. Never take an antibiotic for a viral infection like the cold or the flu. Never pressure your healthcare provider into prescribing you an antibiotic. And never save antibiotics for the next time you get sick, and never take antibiotics prescribed for someone else. Taking the wrong medicine may delay correct treatment, allow bacteria to multiply, and cause unwanted or severe side effects. The safe thing to do is to always discard any leftover